Good evening, everybody. I am Dr. Athar Pasha. Today, I am going to speak about diabetes on behalf of the World Diabetes Day, which is being celebrated every year to create more awareness about the illness, its complications, and its treatment. Uh, Today, we are all busy with our day-to-day work post this pandemic, and we have seen a lot of people have lost their lives, particularly people who were diabetic and obese. Now this illness is actually very more dangerous than the what we thought of this COVID-19, because this COVID-19 severity has increased in this people who are having a poor sugar control, and particularly people who are very careless about their health, who never given a thought for taking medicines regularly, and still people think after the complete recovery from the COVID-19 also, people are still they are not regular to their medications, and that's very poor. And today we are going to talk about even the IDF theme, which is for the diabetes this next 2 years, that is the accessibility of the diabetes care to each individual. As we belong to India, and in India, more than 70% of individuals, they live below the poverty line, and which suffer with the access to the diabetes care, and which makes it very difficult and challenging for the doctors to give a care to people who really can't afford in a very affordable way to the patients. So my first thing to all the patient, to the common people, is that don't let the disease come into you first. You have to identify the things that actually bring you towards this illness. That the first most important thing is the sedentary lifestyle, which brings obesity to you, and along with the obesity you get all the the pack of all these things. The cholesterol gets bad, the sugar gets high, you have a high blood pressure. These all together, they contribute towards the cardiovascular illness. They cause cardiovascular morbidity. You get a lot of patients with heart attacks and all. And second impact is on the your stroke, like the brain health. It also contributes towards a lot of patients of chronic kidney disease. They belong to diabetes. Because of the diabetes, poorly controlled diabetes, we see a lot of patients, they come up with this chronic kidney disease. And people have a lot of actually false belief that the insulin will cause the kidney illness. It will aggravate, or they feel that taking insulin is a last resort for diabetes, which is not, because the insulin requirement in a person actually depends upon his own glycemic control. Some patients, they respond to a very minimal dose of the tablet. Some patients require 4 times of insulin. So it basically depends upon your pancreatic function. So don't think that the initial level, if you have been started off insulin, it doesn't mean that the end of the world, or like you're going to lose your life, or you're going to have a kidney problem. These are all false beliefs and false things which people fall into prey. Please don't go for forcefully taking pills and all, and creating more damage to your health. Take what the doctor suggests, that they do repeated tests to find out whether your glycemic control is bad. The most important test that we do in diabetic patients to actually do to find out their glycemic control is the HbA1c, which is the single marker which will tell you about your glucose health. And earlier there was it was very difficult for the accessibility. Now the state government itself, they have got so many machines which are freely now can be tested at so many Telangana diagnostic at free of cost, at the same quality, and which will give you a very good access to the healthcare. So I encourage all of you who can't afford, please go to these diagnostic centers which actually provide free of cost, because the population is very high, the prevalence of the disease is very high. So you may get difficulty in access to all these centers, but they are freely available across this Telangana, and people who can afford somewhat, so you can go to some private diagnostics which are lower affordable, which are quite affordable, and you can go for them. Get your regular checkups done once in 3 months, 6 months, or yearly. People who have cardiac illnesses, I encourage them to get a 2D echo and a cardiology consultation once in a year. Don't ignore your health. Your eyes also are very important. Because of the diabetes, a lot of people lose their visions because of the involvement of the retina. So get a regular eye checkup done once in 2 years at least. Get your kidney checkup once in 6 months, and take your medicines regularly. And most important and the foremost thing is that patient should have a machine with them, a glucometer, a good device which is recognized by the government of India, that's the DCGI, and monitor your sugars regularly at home. Don't visit the lab frequently for just checking your fasting and post meal sugar. Get them checked at home, and there are a lot of machines available now at very affordable prices, and even the glucose strips are now reduced a lot in the prices. So I encourage you to get them, do the test frequently, so that you will come to know your glucose levels. Second thing that is most important is you follow your proper diet regime. Avoid taking all the things which will raise your sugars, particularly the refined sugar itself, the sweets, and particularly the maida flour, which actually are bakery items. All these breads and these pizzas and burgers, they're destroying our health. Please don't stick to all these things. Avoid all these things. Regular exercise is very important. People who are elderly, more than 50 years, I recommend them not to strain their body very much. We see a lot of people nowadays losing their life with excessive straining. So please do exercise, train your body, don't strain yourself with the physical activity. Do light exercises. Speak to your doctor. They can actually come up with customized exercises for you. You may have some people with diabetes will have a lot of obesity, and that will limit them to walk or do a brisk walk, where you can do other exercises like cycling or swimming, or you can do some floor exercises at home itself when you are don't have a time to go to gym. The other thing, most important, next to the checkup and exercise and your diet, is the medicines. And taking medicines is the most important, which I told you, that you please follow what the doctor says, what not your neighbor or your friend or your family relative. And there are a lot of people who are prescribing the drugs. Oh no, when sugar came to me, the doctor prescribed me this drug and it reduced. No, it is not like that. It has to be a tailor-made treatment, customized according to the needs of the patient. So every patient sugar will not be same, every patient's body will not be same. So the treatment part, let the doctor decide, not your friend or your neighbor or your relative decide. And you can take their advice, but for following a good diet or visiting a doctor or doing good tests, but not for medicines. Please follow the medicines what doctors suggest you, and take care of your health, because diabetes after 10 to 15 years, if not controlled good, will impact your all the organs and will bring more disability to you. टेक केयर, थैंक यू।
ज़ेवरात की दुनिया में शहर हैदराबाद का बाएतिमाद नाम मीर मुस्तफ़ा ज्वेलर्स, जो दुल्हन के हुस्न को 4 चांद लगा दे। नेकलेस, चूड़ियाँ, रूबी, रानी हार का शानदार कलेक्शन पेश करते हैं। मीर मुस्तफ़ा ज्वेलर्स, रूबरू मदीना होटल, अल्फाज स्कूल, हाफिज़ बाबा नगर, हैदराबाद। 0402444657।